Today we are going to talk about lab values. Are they important? Is it important to memorize the lab values? Are you having difficulties with remembering all these lab values? And should you actually bother? After all, they give you a lab value sheet on the exam. So why should you stress yourself learning the lab values, right? It's very important to know what the lab values are. It's too important to just not do it. Okay, it's just too important to ignore. You need to learn the lab values. You need to know the normal sodium, potassium, BUN, creatinine, red blood cell count or number, hemoglobin. You should know all those things in your head before you go into the USMLE exam hall. I'll tell you two reasons why you should know your lab values. Number one, if you know the lab values, you're going to save time. It's a lot of time, trust me, when you accumulate it, to scroll to that portion of the screen where they have the lab values, click on it and then scroll up, search for the lab values. No, that's too much time spent. That's too much time spent. Don't you think so? And that's not something you probably want to do on the day of your exam. If you know the normal sodium levels, immediately you see it. If you see sodium level of 126, you automatically know, okay, this is low. So your brain begins to work at that pace. You don't want to see sodium and then you ask, is it high? Is it low? Right there, you've slowed down already. It tells you that your pathology is not good. One of the ways to know when your pathology begins to get better is that you begin to get better with the lab values as well. When you see the potassium level, you easily know, okay, this is high, this is low, this is okay, this is slightly increased, this is slightly reduced. Maybe it's not too bad. When you begin to know those little things about lab values, your pathology automatically jumps up a notch. One is going to save you time. Two, it's going to improve your pathology. When you know the normal lab value, you are going to easily begin to notice when certain conditions begin to change the lab values, and you begin to associate different differentials with various changes in lab values, and that will increase your performance a whole lot. Go out there, learn the lab values, practice questions. As you do questions, see questions on lab values, you would see that lab values are so important that you can actually use just the lab value to make a diagnosis, or to give at least a good enough or close enough diagnosis, and that will help you also in answering questions. I use it to double check answers to be sure that I'm not making a mistake, and we'll talk about that in the next video. Thank you. Please subscribe if you're not subscribed, and remember to hit the like button, share with a friend.